Hello, I'm Isaac White. I'm a hearing aid dispenser at Elk Grove Hearing Care, and today I'd like to talk to you about what to expect when getting hearing aids. Really, it's about a 6-point conversation. In order to get hearing aids, we need to do an evaluation of your hearing. Inside this evaluation, we'll figure out how your hearing looks and how it affects you in life. One of the tests you want to be sure that you get done is a quick-syn or a noise and background test. This will help us determine how much help you need when you're engaged in group situations and background noise, places like restaurants and churches. Number 2, after we do a hearing test, we want to sit down and help you understand your hearing loss. After we understand our hearing loss, then it goes into product selection. So that's where we want to decide how large or how small of a hearing aid we have, what color it's going to be, the style it's going to be, and even the technology level. The technology level is probably one of the most important when it comes to selecting the hearing aid. We want to make sure we're going to get something that's going to be effective for you and the life that you live. So number 3, delivering the hearing aid. Usually this is done at a separate appointment. That's when we fit the hearing aid to your ear. We make sure everything fits correctly, and we're not going to cause any sore spots. We want to program the hearing aid, and then we want to validate the programming. That's another very important step we don't want to miss. After that, we usually set the volume to a very comfortable level to get started. We don't want you to go home and realize how loud the world really is on the first day you're fit with hearing aids. Number 4, follow-ups. So after we deliver the hearing aid, it's fit, you go home for a week, and you experience sound like you haven't experienced it before. We need to see you back a few more times. It's not over just yet. First, we set you at a comfortable level, so we're going to have to turn you up a little bit. We want to get you turned back up to the volume that we initially set you at, but we turn down to make comfortable. So as you get used to wearing hearing aids, you're wearing them 8, 10, 12 hours a day, then your brain gets used to the volume and we can turn you up a little bit. So we'll be working on turning you up, but we're also going to work on some of the problems we're having. So in that first week, you're going to experience all kinds of sounds that you haven't heard in a long time, and some of them you're not going to like. So bringing your complaints back to us gives us a little bit of time to make some adjustments to try to make it all a little bit better. It's fine-tuning. We expect us to see you at least 2 more times, but typically not more than 4 more times after the initial fit, to get everything fine-tuned specifically for you. Number 5, after those follow-up appointments, then we need to see you on a routine basis. Typically we see our patients twice a year, once every 6 months. We like to clean the hearing aids, and then once a year we also like to do a hearing test and clean the hearing aids. If our hearing changes, we have to make sure that we change the programming in the hearing aid in order for them to keep their effectiveness. We want to keep the electronics clean because that's what hearing aids are. They're electronics. So when they get dirty, they malfunction and they don't work right. Number 6, the life expectancy of a hearing aid. We usually say hearing aids last between 5 and 6 years. The average wearer upgrades hearing aids around 4.5 to 5 years. Hearing aids don't last forever. They're electronics. They eventually fail. That being said, most hearing aids have a warranty from the manufacturer that vary between 1 and 3 years. And then after that, they can typically be repaired when sent back to the manufacturer if we're having additional problems. So if you first notice that you're starting to struggle with your hearing, make sure you go to the right place and get all the right tests and the right recommendations. Come see us at Elk Grove Hearing.